27. A client with a spinal cord injury at the level of T4 is at risk for autonomic dysreflexia. Which symptom indicates this complication? Bradycardia. B. Hypotension. C. Headache. D. Hypoglycemia. Answer C. Headache. Rationale. Autonomic dysreflexia is a life-threatening condition that occurs in clients with spinal cord injuries above T6. A severe headache is a common symptom due to sudden hypertension. 28. A nurse is assessing a client with acute cholecystitis. Which of the following symptoms is most characteristic? Left lower quadrant pain. B. Right upper quadrant pain radiating to the shoulder. C. Epigastric pain relieved by eating. D. Nausea without vomiting. Answer B. Right upper quadrant pain radiating to the shoulder. Rationale. Acute cholecystitis typically causes pain in the right upper quadrant that may radiate to the right shoulder or back. 29. A client is receiving a blood transfusion and reports chills and low back pain. What should the nurse do first? Administer acetaminophen. B. Stop the transfusion. C. Slow the transfusion rate. D. Notify the healthcare provider. Answer B. Stop the transfusion. Rationale. Chills and low back pain are signs of a possible transfusion reaction. The first action is to stop the transfusion to prevent further complications. 30. A client with type 1 diabetes is admitted with diabetic ketoacidosis, DKA. Which of the following should the nurse prioritize? Administer regular insulin for. B. Monitor fluid balance. C. Check urine output. D. Administer potassium. Answer A. Administer regular insulin for. Rationale. The priority in treating DKA is to lower blood glucose levels with 4-insulin. This also helps stop the production of ketones. 31. A nurse is caring for a client with chronic obstructive pulmonary disease, COPD, who suddenly develops respiratory distress. What is the priority intervention? Increase oxygen to 6 liters per min via duct nasal cannula. B. Encourage the client to cough. C. Administer a bronchodilator. D. Perform postural drainage. Answer C. Administer a bronchodilator. Rationale. A bronchodilator will help to open the airways and improve breathing during acute respiratory distress in COPD clients. 32. A nurse is preparing to administer a nasogastric tube feeding to a client with a gastrostomy tube. What is the most important action before administering the feeding? Warm the feeding to room temperature. B. Verify tube placement. C. Flush the tube with 30 milliliters of water. D. Position the client in a supine position. Answer B. Verify tube placement. Rationale. Verifying the placement of the nasogastric tube is critical to ensure that the feeding goes into the stomach and not the lungs, preventing aspiration. 33. A client with chronic kidney disease has a hemoglobin level of 8 grams per deciliters. The nurse anticipates which treatment? Blood transfusion. B. Iron supplements. C. Erythropoietin therapy. D. Dialysis. Answer C. Erythropoietin therapy. Rationale. Erythropoietin is given to clients with chronic kidney disease to stimulate red blood cell production and improve anemia, commonly seen in these clients. 34. A nurse is caring for a client with increased intracranial pressure (ICP) after a head injury. Which action should the nurse avoid? A. Keep the head of the bed elevated to 30 degrees. B. Provide stool softeners to prevent straining. C. Cluster nursing activities together. D. Maintain a quiet environment. Answer C. Cluster nursing activities together. Rationale. Clustering nursing activities can increase ICP. It's better to space out care activities to prevent sudden increases in pressure. 35. A client with newly diagnosed asthma is being discharged with an albuterol inhaler. Which instruction is most important to include in the teaching? Use this inhaler every 4 hours to prevent attacks. B. This inhaler is used only when you are having symptoms. C. Rinse your mouth after using this inhaler. D. Keep the inhaler in a cool place at all times. Answer B. This inhaler is used only when you are having symptoms. Rationale. Albuterol is a short-acting bronchial used for quick relief during asthma attacks. It is not for routine use. 36. A nurse is assessing a client with pneumonia. Which finding requires immediate intervention? Productive cough. B. Dyspnea at rest. C. Fever of 101 degree Fahrenheit, 38.3 degrees Celsius. D. Rhonchi and lung fields. Answer B. Dyspnea at rest. Rationale. Dyspnea at rest is a sign of respiratory distress, which requires prompt intervention to prevent further deterioration. 37. A client is admitted with acute diverticulitis. The nurse should anticipate which dietary order during the acute phase? High-fiber diet. B. Low-fiber diet. C. Clear liquid diet. D. Regular diet. Answer C. Clear liquid diet. Rationale. During the acute phase of diverticulitis, a clear liquid diet is prescribed to allow the bowel to rest and reduce inflammation. 38. A client with rheumatoid arthritis is prescribed methotrexate. Which of the following should the nurse include in the teaching plan? A. You will need regular blood tests to monitor liver function. B. This medication can be stopped if your symptoms improve. C. Avoid taking folic acid supplements while on this drug. D. Expect immediate relief from symptoms after starting the medication. Answer A. You will need regular blood tests to monitor liver function. Rationale. Methotrexate can cause liver toxicity, so regular monitoring of liver function is necessary. 39. A client with ulcerative colitis is experiencing a flare-up. Which of the following interventions is most appropriate? Encourage a high-fiber diet. B. Administer corticosteroids. C. Start parenteral nutrition. D. Administer antidiarrheal medication. Answer B. Administer corticosteroids. Rationale. Corticosteroids are commonly used to reduce inflammation during ulcerative colitis flare-ups. 40. A client with bacterial meningitis is placed on isolation precautions. Which type of isolation is required? Contact precautions. B. Droplet precautions. C. Airborne precautions. D. Standard precautions. Answer B. Droplet precautions. Rationale. Bacterial meningitis is spread through large respiratory droplets, so droplet precautions are necessary to prevent transmission. 41. A client with heart failure is being discharged on furosemide Lasix. Which electrolyte should the nurse emphasize the importance of monitoring? Potassium. B. Sodium. C. Calcium. D. Chloride. Answer: potassium. Rationale. Furosemide is a loop diuretic that can cause potassium depletion. Monitoring potassium levels is crucial to avoid complications such as arrhythmias. 42. A nurse is preparing a client with colon cancer for surgery. The client asks, "Why do I need a nasogastric tube after surgery?" What is the nurse's best response? To prevent vomiting. B. To reduce the risk of infection. C. To prevent aspiration. D. To decompress the stomach. Answer D. To decompress the stomach. Rationale. After abdominal surgery, an NG tube is used to decompress the stomach and prevent the buildup of fluids and gas. 43. A nurse is caring for a client post-thyroidectomy. Which assessment finding is most concerning? Hoarseness. B. Difficulty swallowing. C. Tingling in the fingers. D. Sore throat. Answer E. Tingling in the fingers. Rationale. Tingling in the fingers may indicate hypocalcemia due to possible damage to the parathyroid glands during surgery. This requires prompt intervention. 44. A client with a history of stroke has residual dysphagia. What is the priority nursing intervention to prevent aspiration? Administer thickened liquids. B. Feed the client quickly. C. Keep the client in a supine position. D. Offer small amounts of food at each meal. Answer. Administer thickened liquids. Rationale. Thickened liquids are easier to swallow and reduce the risk of aspiration in clients with dysphagia. 45. A client with a DVT is receiving heparin. Which laboratory test should the nurse monitor to evaluate the effectiveness of the medication? INR. B. Platelet count. C. APTT. D. Hemoglobin. Answer. APTT. Rationale. The activated partial thromboplastin time, APTT, is used to monitor the therapeutic effectiveness of heparin therapy. 46. A nurse is caring for a client with cirrhosis and ascites. Which intervention is most appropriate to reduce fluid retention? Restrict sodium intake. B. Encourage a high-protein diet. C. Administer lactulose. D. Provide fluids to promote diuresis. Answer. Restrict sodium intake. Rationale. Sodium restriction is a key intervention in managing ascites in clients with liver cirrhosis to prevent further fluid retention. 47. A client with Parkinson's disease is experiencing bradykinesia. What is the most appropriate nursing intervention? A. Encourage deep breathing exercises. B. Promote physical exercise. C. Provide a low-protein diet. D. Administer corticosteroids. Answer. B. Promote physical exercise. Rationale. Physical exercise can help improve mobility and reduce the effects of bradykinesia in clients with Parkinson's disease. 48. A client with multiple sclerosis is prescribed baclofen. Which statement indicates the client understands the medication? A. This medication will cure my condition. B. This drug will help reduce muscle spasticity. C. I will need to take this medication with food. D. I can stop this medication once I feel better. Answer. B. This drug will help reduce muscle spasticity. Rationale. Baclofen is a muscle relaxant used to reduce spasticity in clients with multiple sclerosis. 49. A nurse is caring for a client with nephrotic syndrome. Which of the following is a priority intervention? Administer diuretics. B. Monitor protein intake. C. Restrict fluids. D. Encourage a low-fat diet. Answer. Administer diuretics. Rationale. Diuretics are used to manage edema, a common symptom of nephrotic syndrome due to fluid retention. 50. A client with peptic ulcer disease is admitted with black, tarry stools. What is the most appropriate action by the nurse? Administer antacids. B. Notify the healthcare provider. C. Place the client on bed rest. D. Check the client's temperature. Answer. B. Notify the healthcare provider. Rationale. Black, tarry stools indicate gastrointestinal bleeding, which requires immediate medical intervention. How many did you score in these quiz? Let me know in the comment below. See you in the next video.